All right. Welcome back to Pulling Threads, where we explore ways the mind, body, and soul weave together to shape our health, happiness, and joy. I'm your host, Leslie Mathews. I'm a therapist, mom, and advocate for mindful, authentic living. Today's episode is super close to my heart. I'm sitting down with Dr. Kelly Cross, a board certified pediatrician and integrative medicine practitioner right here in my town of St. Petersburg, and my children's pediatrician and my friend who has been with us through lots of things. So Kelly's been caring for families, correct me if I'm wrong, for over 24 years. Is that correct?
I've been a MD for 31 and a pediatrician for 28.
Okay. And you frequently talk about food as medicine to address everything from ADHD to mood and sleep and lots of challenges. So we're going to focus on that today, but we may be diving into some other things. What's really happening in our kids' brain when they consume some of these things? There's a lot of talk right now about food dyes and whether they're going to be removed, whether they're not, preservatives, processed foods, and how simple real foods can change kids' behavior and attention. And I wanted to bring Kelly on to talk about a lot of that because my family has seen just incredible changes by removing as many chemicals as we can from our diet. So, as a mom who's seen firsthand how chemicals and dyes can affect both me and my son. I would have never known if I hadn't removed it from his diet that it was also impacting me. I can't wait to kind of explore this topic with Kelly and get her opinion. But first, whenever I have someone come on the show, I like to talk about their journey and how they got where they are and what really inspired them. And specifically for you, Kelly, I would love to hear what you want to share about how you shifted kind of toward integrative medicine and what you're doing now.
Sure. So I would say it was about 10 years ago now. I had a patient that was really, really sick, my most severely autistic kiddo. And the family was amazing. Mom became an ABA therapist. She was doing everything she could. This kid was on so many antipsychotics, really strong medications, so close to being institutionalized. And I had a friend from residency who had really shifted and was doing just integrative care. And I touched base with her on a girls' trip. And she was like, I'm safe. I'm not going to do anything that would harm a child type thing. So I sort of brought up Carmen Baez Franceschi's name, and she has a whole integrative clinic in Houston to my patient because they were desperate. So I said, look, she's not going to do anything crazy. She's not going to hurt him, but, see if she can help. So she worked him up. And it took a while. And then she talked to me about everything before she started anything because she knows me and I'm going to want to know what you're going to do with my patient. And really, the things that she did, the dietary changes to take away certain food sensitivities, and he didn't detoxify. So she gave him things to support his immune system and just kind of cleaning up his diet, supporting him with the nutritional supplements that he needed. It was all things that I researched and found in the NIH data, but it's just not commonly known to us. It's not part of the mainstream medicine field. So really what I noticed, it took a while because changes like this, it's not a pill that's magic and overnight, but it took, 6 to 12 months, but this kid started getting better. He started weaning off his antipsychotics, his behavior calmed. I mean, he was 13, 14, and she said, things aren't going to be normal. He's not going to go back to being a neurotypical kid, but it changed him dramatically. And then so I started going to conferences with her because it was so powerful and so moving to see the difference that really just food changes made in him. And so it sort of inspired me to, in addition being a board certified fellow for the American Academy of Pediatrics, practicing traditional medicine, to learn about some of the integrative medicine. I am not a certified integrative medicine doc, but I've attended pretty much annually the integrative medicine mental health conference that has probably 30 or 40 of the best integrative docs in the world speaking at it every year, and just trying to delve into what lessons I can learn and what I can apply to my traditional practice to kind of help my families. So she was sort of the inspiration for that, and that patient who really improved. So
That's amazing. And since then, you've helped many, many other families. How many years ago was that, you think?
That was about 10 years ago, and then I started attending. So I started shifting. It was harder when I was in a fee-for-service practice because, as you know, because you were there with me, fee-for-service practice in pediatrics is very volume-based. You have 10, 15 minutes per patient. So then I opened my direct primary care practice with Dr. Lisa Logue in 2021, and now I can schedule an hour with families so I can spend more time with them. I have a chance to talk about like additional testing, or I can talk about trying to try more sort of integrative things. And then I started speaking at schools. I had always sort of advocated for kids that were alternate learners. My son has ADHD and learning differences, and we really helped him. So I would speak at schools, educating providers or educating teachers as well as families. But then I sort of shifted and started doing these food as medicine talks, which really it's not. I mean, everybody knows you're not supposed to, eat garbage or you're going to get heart disease or diabetes, but it's really food as medicine based on nutritional things related to psychiatric and developmental issues. So it's the sort of movement of nutritional psychiatry is sort of what I've tried to embrace and what I teach at really all levels in my practice. And thankfully, I'm in a situation where I have time and I have the ability to do those things.
Yeah, that's really important because there's so many more things, so many more questions, and so much more time needed to figure this out,
Yeah.
especially for kids who do have more of a reaction. We'll get to that. But how do you help families kind of balance the traditional medical approaches and lifestyle and nutritional changes and, like you said, some of the alternate practices? Um, I'm assuming now it's becoming more mainstream, but I know for me, we switched. We went with you from very traditional medicine, and I was married to a traditional medicine doctor, and then switched over. And now I feel like we have a really nice balance of both. But how does that work for you on your end?
Well, it works. Thankfully, since I control my practice, I can do whatever I want. But I think the thing that I love about sort of the term holistic treatment is it's the person as a whole. And that's true for all of us. You sleeping, what are you eating? What is the time that you're spending on a screen? How are you taking care of yourself? Are you exercising? So like the whole person, as opposed to when you have 15 minutes and you said I have to rush through the basic questions. So I love, with the babies that we take now, I feel like I address things so differently than when I first came out because now I'm like making sure that, mom is supported for breastfeeding, or if she can't, that we have organic, cleaner formulas, that we do baby foods that are tested for heavy metals. Like I feel that things, when I had a colicky baby when I first came out, they were all like, put them on Zantac. They're just, now I'm like, okay, why are they throwing up all the time? Why are they arching? There's a problem with the food that these babies are taking. So I have the time to figure out those pieces. And I'm always sort of interested 10 years down the road, these really colicky babies that we change those things. They may not have those neuroatypical things because I feel like we healed their gut when they were really young. So that to me is the most exciting piece. For the older kids, you kind of have to backpedal and get history. Were they a refluxing kid and were they a kid that had lots of ear and sinus infections, and kind of have to piece together what was the problem along the way that kind of led us there. And for many kids, it's nutrition based. And I get so sad. My husband's a public school teacher, and like the school's food that they provide, like, and many of our friends are teachers, like one of the school choice breakfasts, like 4 different kinds of Pop Tarts, or honestly Kool-Aid in a bag. And I think you wonder why kids are having behavioral issues at school when you're loading them up with sugar and dye and chemicals first thing, instead of having just even an apple with peanut butter or just something with some nutritional base to it to support them. So I don't know if that answered the question.
Well, it did, and it also prompted me to ask a bunch of other questions and bring up a few things. It's interesting because if you remember when Jack was little, he had a hard time with his formula and he had the reflux, and Jack has my permission to talk about what we've been through with him. But when he was little, very firstborn, an infant, you were still in the traditional practice. And this is a very timely interview also because we kind of figured out that he did have really extreme sensitivities to chemicals when he was 4 around this time of year because it was Halloween, and it really tipped him over. He had always struggled with reflux. We knew something was off. We treated him traditionally. And then it got so bad around Halloween because of the amount of dye he was consuming and the accumulation that he was presenting almost like an autistic child. And the school was like, we don't even know if we can keep him in the classroom. I mean, it was that extreme. And I was like, what are we doing right now? Like, what could this be? I remember telling you, you're going to think I'm crazy, but I took all the dye out and it's been 30 days and he's a whole different kid. Like the teachers don't even recognize him. All the behaviors were gone. And then we ended up doing no gluten and no dairy for a while because he was so sensitive to glyphosate. And it just took us on a whole journey, which also helped me realize, wow, when I took away the dye and all the chemicals for Jack, I stopped having a lot of rage and a lot of anger that I thought was from sugar. It was really from the chemicals. And it's changed his whole life. So I really want to talk about chemical dyes and additives and like what you think the biggest culprits are. Because in my mind, if we had never figured that out, we wouldn't be at the school. He's a straight A student. He's kind. The teachers all just love him and respect him. And we are starting to see some things pop up. So I want to get to adolescence and your thoughts are on dyes in adolescence versus when he was little. But what do you think the biggest culprit in our food? What are the biggest culprits right now?
I hate glyphosate. I mean, I always say Roundup is my enemy, and the history of it that it was started with Monsanto's, took a pipe cleaner and decided to put it on our foods and then genetically alter our foods so that they're so undigestible that they don't get killed by a pesticide. And then we're eating the pesticides and we're consuming food that's not digestible. So that's one of the reasons why so much of the food that we now take in our body in the United States is an issue. So glyphosate is its own nightmare, and that's horrible. I think for specific kids, it's different things. Some kids it's red dye 40, some kids it's all food dyes and processing. And I mean, if you look at the European model, I love Europe. I drag my poor husband to Europe every 4 months because I can eat everything and I just love the food chain. And I love that they respect the food chain, that they don't have these dyes and chemicals. I had a girlfriend who, in her second marriage, went to Norway on her honeymoon, and she's like, "All the M&Ms are brown." I'm like, "All the M&Ms should be brown."
They should be brown. Yes. Those are good M&Ms and they taste better.
It all tastes better. So yeah, I think it's kid specific which dyes, which chemicals are going to affect them the most. But in general, no one should be ingesting these chemicals. The red dye 40, there's so many studies. I always, when I do these talks, I joke about how I never volunteered on Valentine's Day because the red dye made all the kids squirrely because the data actually shows it's not just neuroatypical kids, it's all kids that those dyes can trigger hyperactivity. So like, why are we feeding this to our children?
Right.
Even in the adult population, you're seeing like the incidence of colon cancer and GI cancers. It used to be you had to get your colonoscopy at 55, then you had to get it at 50. And now, like, they're talking 35, 40, they're diagnosing these people. And it's the amount of pesticides, chemicals, dyes, poison we're ingesting that's causing these, GI cancers. And it's scary.
It's
So,
very scary. Yes. And it's not just kids. In my experience, it's not just kids who are affected by this. Quick story, when I first met my now boyfriend, we went on a trip and everything was great. We were in a tropical location. It couldn't have been better. I had never seen him really eat much sugar or sugary stuff, but we were on vacation. He ate a red velvet cupcake and then another one. And that night he was in the worst mood. Like aside of him, I was like, who is this person? What has happened? And it continued for a couple of days because he kind of was like, these are the best. And I was like, you're not feeling great. Do you think that maybe it's all that red dye? He had no idea. No one had ever talked to him about the food and the dyes and the chemicals. And he really didn't buy into it at that point. But now, fast forward, it's been 2 years, and he's finally started listening to me on my bandwagon about mental health and food. I mean, all of my clients I'm like, what are you consuming online? What are you consuming via your mouth? Like because it's all related. And he's given up all of that and swears by like that he has a sensitivity to red dye. Now, Jack, when he was tested at USF, where you sent us, he did have a skin reaction to, I think, yellow, green, and blue, but not much to red. So everyone is different. Every person is different. But for him, it's the result is really like rage and almost like irrational behavior. And I always think about other kids who don't have a choice. Like they don't have access to organic food, to clean food, to whole foods where they don't sell anything with chemical dyes. They just go, they're at school getting in trouble, which I'm sure your husband sees. It's so unfair that we can't go to the grocery store and buy affordable food that doesn't have this in it.
Well,
Do
and
you-
if you look in our country, really the people that are the poorest eat the poorest. Like if you look
Yes,
at third world countries, they often eat the processed foods are more expensive, whereas in our country, and part of that is the government subsidies. They subsidize the people that make Doritos and Fritos, subsidize an organic farm that's giving apples to make that more affordable. And I know from, our churches in an area that's a food desert. And I have gone to around the corner to the dollar store to buy things for Sunday school, and people are using their EBT to buy their food at the dollar store. And what's at the dollar store? It's Kool-Aid, it's ramen noodles, it's nutritionally void school, but if it's or void food, but if that's the only place you can get it, that's what you're going to get. So and sort of the education and awareness. Like, even I'm sure your boyfriend is an educated person, but it's interesting for me when we educate families about the kids that then it carries over to the adults.
yeah,
Like my son was very sensitive to gluten and we took gluten away. So I took gluten away because it's unkind to sit there, oh, I'm going to have pizza in front of you. But then I noticed when I eat gluten, I have horrible back pain and leg pain. But I'm like, would I have had back surgery if I didn't take gluten out? But ironically, I can eat gluten. It's probably why I go to Europe all the time because
yeah,
it is Croissant Palooza. I am eating gluten the minute we land because it doesn't bother me there. So our food chain is broken, but I think we learn from our children because we see the effects and the behaviors on them, and we can realize that it affects us as well. And it's nice that, the place that I sent you will actually test for those things because it's hard. It's hard for families to find out where to go and who to listen to. So it's wonderful you figured out those sort of puzzle pieces. It's tricky because with kids, everything changes. It's all so when they're babies, they reflux, and as they get older, there's some issues, but especially as they navigate like the teen years, once puberty hits, it's just craziness. And a lot of times these sensitivities are worsened. So just like they want to fit in, they want to be part, and every, golf team, every whatever, there's a parent that's going to bring Gatorade and who doesn't want to participate and take place in that. So it's hard as a parent to try to avoid those things. I was always the mom who would bring the dye-free stuff just because I'm like, I have some for everyone. So
yeah.
your kid is the one that stands out, but definitely when they go through growth spurts, when they're navigating those puberty years, everything's more sensitive, everything's going to be triggered more. So it's all kind of educating, and they also have choice and freedoms. So it's
Right.
really trying to educate your child that, maybe this isn't the best choice. How do you feel after you eat that? How did it make you feel? Are you upset with like the choices you made after you took that in? So
Yeah.
we have to, because eventually he's going to go to college. He's going to be out in the world and he's got to make those choices on his own. But that's kind of the difficult time. Then you have to let them fall a little bit and see this is the reaction. And then, they have to start taking a little control over it.
Yeah, and you just described exactly what we've been going through because I had a very tight grip on what the kids were eating, even though there was a lot of pushback throughout elementary school from other parents, teachers. Oh, you're sensitive. Da, da, da. And I was oftentimes thinking, yeah, your kid's probably sensitive too. Everybody's probably a little sensitive. Jack's just more sensitive than most. But what you said about the teen years, like we'll be talking about it on his next visit with you because we are definitely seeing, I've lightened up my grip on it and let him make his own choices, and he gets to choose when he's with his dad. So he's had some die, over the past year or two, more so than before. But now, like I'm seeing a complete breakdown after one Gatorade. Like total meltdown on in the middle of a golf match. And I'm like, buddy, I think because of probably puberty and all the changes you're going through, you may be more sensitive right now, which is really hard for him to hear. But there are alternates. So we went online and we looked up body armor doesn't have much chemical in it, if any, and it doesn't have any dye. I was like, okay, let's try every flavor. We'll make a fun little day out of it, trying new drinks. But it is hard. And you're right, he has to learn and see the impact and make the choice because soon he'll be going away and be on his own and I can't control what he's eating and drinking. But I look around at so many other boys his age who are struggling, and I just think, wow, would they not have to struggle so much if they weren't drinking the Gatorade and eating the Skittles? And like, if that one change could change their whole life.
Well, I think there's, the dyes make a big difference. Even the organic eating, when they're eating pesticides and chemicals, like I firmly believe obesity in America is actually from glyphosate. I think we've eaten so many pesticides and chemicals that it kills our good gut biome, all the good bacteria that we need that now we know, gives you all the serotonin and helps you process things. We're eating pesticides, it kills those, and then yeast overgrows, and then the yeast makes you crave the sugar. So
Right.
everyone blames the sugar, but it's really the yeast in our gut. And then so now you have leaky gut from the pesticides. Then you expose them to the dyes and the chemicals. So it's all kind of cumulative that, if you can try to eat clean and organic as much as possible. And then I think also, we crave what makes us sick. People often, and I see that all the time. I used to see kids with mental health issues that were just like eating a whole loaf of bread a day and nothing else. And when you'd have them tested, they're gluten sensitive. And it's almost like we crave what makes us sick.
Yep.
And so that is a whole nother dimension of trying to understand, okay, I really want this thing that's making me sick, but what can I do to kind of stay away from it? So,
Right.
and that's for kids.
Yeah, I've learned a huge red flag for myself is when I'm craving sugar, like middle of the day, I can't stand it. I need to go get licorice or something. I know, okay, I need to do something with my probiotics because I know now it means that I have yeast overgrowth in my gut. Like something has triggered it because it's out of control. And when I see that happening with the kids, but I think most people don't realize that. They don't know. They just don't know.
I think that's a component, and I would tell everybody because you have the hangry kids. I mean, toddlers are a prime example of, if they don't sleep, they don't eat, they're a hot mess. And so many of them, protein is the answer. If you
Hmm.
have small amounts of protein, clean protein more frequently, then their blood sugar balances, and then you don't have the spikes and the cravings and those type of things. So it's cleaning up their gut, trying to take the things away, but it's stepwise. I sort of love the godmother of nutritional psychiatry, who's at Harvard, Umanadu. She gives the 80-20 rule, which is 80% of what you eat is clean and 20% is processed. Like we live in a real world. The reality is you can't, if you take your kid and take every single thing away and say you can never have that, that's the kid that's going to run to school when they get a chance and be at 7-Eleven,
Oh,
drinking the
yeah.
smoothies and eating all the garbage. So I think 80-20 is a fair rule. And you talk about the 20, like these are the processed things that I think are like the least likely to cause problems for you. So they have their treats and they have their snacks. But I always say for the 80 kids are like, well, what's real food? I'm like, you pulled it out of the ground or you hit it over the head. Like it just looks like what it's supposed to be, as opposed to something that came out of a factory and was very. And I also think there's a component where they have this phrase dirt poor. Like I always say, I'm a child of the 70s. The single mom, I was Susie Q's wearing my lunch every day. It's not like I was eating kale. It's just it was what it was. But because glyphosate and those chemicals weren't around as much, the food actually had a little more nutritional value. Like an apple or a carrot from 1970 was healthier because the glyphosates pulled so many of the minerals out as well. So there's a component of even the processed stuff is worse than the processed stuff used to be.
So, what do you recommend people look for on food labels? Like, are there certain things that most people wouldn't be aware of? We know that the dye is on there, but for foods to avoid, like what would you see on a label?
I'm a big fan. I like the little green circle that says USAID organic. Publix, thank you for employing my son, and I don't want you to fire him, but Greenwise is a big lie. Because Greenwise is not organic. People think it's
Oh,
organic, but Greenwise is not organic unless it says organic Greenwise and has, the stamp that says USDA. They can say, and if you read the label, it's kind of terrifying. Like the Greenwise meat, it'll say wasn't fed other animal products, meaning like they didn't
oh,
feed pork. So yeah, it's super gross. So yeah, so I think seeing USDA organic matters. I think the hardest thing is it's so expensive. We eat primarily organic, but I tell everybody frozen is just as good as fresh. It's fine and it's so much cheaper. And I think also when you eat organic, eat in season. Like we go to Rollin' Oats because they have really a whole organic produce section. I don't get Brussels sprouts when they're $8 a pound, but I get them a lot when they're 3.29. So, but it will make you eat seasonally because certain things are going to be more affordable during different times of year.
yeah,
So.
that's a great point. That's a great point. What about, do you have any experience with Aldi? We're getting a new Aldi right by our house, and I don't know. I've heard they have some organic.
So I love Aldi when I'm in Europe and it's super cheap. We went to Portugal and bought like a week's worth of groceries when we were in outside of Lisbon for like $60. It was amazing. And the port wine, oh my gosh, it was cheaper than the water. I was like, you have better port wine? They're like, the wine is cheaper than the water. I'm like, I love these people. So, but yeah, I think that Aldi has some decent options, but you have to be careful because if it's like I said, German manufactured or something but it's made here, then it's not going to be as clean. So, and I know that from being gluten sensitive, that I always have to see, okay, well, you said it was made in Germany because it's a German company, but it was made in Indiana. I can't have this. So I think Aldi can have some options and they're definitely more affordable, but you always have to look at the labels to see, is it truly made in Europe, which is going to be different standards in terms of cleaner and less likely to have the chemicals, or did the company from Europe just make it over here because it's easier to ship it to Aldi? So you just have to, Costco sometimes has great deals. I mean, Costco, you have to buy mountains of stuff. So you kind of need storage for it. But Costco has decent deals in terms of making it more cost effective for families who are trying to eat organic.
Okay. Okay. Can we talk a little bit about specifically how some of the chemicals influence like mood, anxiety, and sleep, specifically in kids and adolescents?
Yeah, so I mean, it will depend on the child in terms of the reaction. I think with smaller children, my friend who, has done organic medicine, it was interesting. When she was feeding her baby food, he was throwing up the baby food, throwing up the baby food, wasn't throwing up the breast milk, and it was the glyphosate because it wasn't organic baby food. So in that child, it was vomiting. As kids get older, like with your son, it's neuroagitation. Some kids they'll feel more depressed or they'll feel more sad. Some kids you talk to them, they're just throwing up in their mouth all the time, so they're getting ear and sinus infections. So just like every kid, the chemical, what affects them is going to be different, but it's also how it affects them is going to be different. So, I mean, the worst case scenario is that it's causing like neuroagitation, like it's going across the blood-brain barrier, and these kids are having rage episodes, having lack of sleep, having agitation. And, again, I always bring up Valentine's Day, those kids act crazy because
Yeah.
they're all running around hyped up, and it's not just the sugar, it's the red dye. And the same thing with Halloween. I mean, I think you can navigate, like for my son with Halloween, we would let him have a couple of snacks, and then the Halloween fairy would come that night and the candy would disappear and his toy would come. You can still experience the going around and getting all the candy, just try to make it go away and try to have some cleaner options, which I feel like there are definitely, like, in my office, we have like the Yum Earth lollipops that are like made with turmeric and pomegranate. Those kids love those lollipops, but they're dye-free and they're cleaner. So there are options to try to find treats that aren't going to make kids sick.
Yeah,
So,
yeah. Jack found something to sub out Takis because he likes those spicy Cheeto things at Trader Joe's, and it's a natural dye. So you have to work a little bit harder to find things, but if they want something and they want to have it often, there's an alternate. You just have to find it. I remember one year we made Peeps because they really wanted Peeps, and I was like, okay, we can make our own Peeps and we'll use sprinkle that was natural dye.
mhm.
So that helped. Can you talk a little bit about specifically for kids who are sensitive and they do have the rage or like what I consider a frontal lobe reaction almost, like they lose their ability to reason. Like do we know what's happening in their brain?
I mean, assuming that it's just a massive sort of dopamine surge, because dopamine is usually the thing that kind of fires everything and gets them going, and you need some, but you don't want too much.
Yeah.
So as far as like the actual biochemical reactions and what's surging, I mean, I don't really know the exact biochemical reactions. I see more of it play out. I think treatment of it, the best thing to do is to try to detoxify the kid. I'm a fan of like Epsom salt baths and like glutathione and things that will help them sort of process and clear those chemicals. But yeah, I don't think I know the exact biochemical reaction that happens. I just know that different kids, it's different. Like I said, some can be sad, some can be sullen, some can be withdrawn, others can be agitated. And I think part of the agitation is probably related to a young boy or a healthy young man that has testosterone. So like you already have this testosterone surge going on, and now you just added something that's limiting your ability to self-regulate, that's stopping you from being able to calm yourself. So a lot of it has to do with physiologically sort of where you're at, just like a woman in menopause might have more hot flashes, or it's just where we all are in our sort of biochemical journey, what manifestation you may have.
Yeah, that makes sense. So I want to talk a little bit about ADHD and food
Mhm.
specifically because I feel like so many people, kids and adults, struggle with ADHD. And we also saw with my daughter Ella that we were able to kind of postpone medical or like, yeah, medical treatment by altering her food when she was young, when ADHD started showing up in her. And again, I remember her teacher saying, "Did you medicate her over Christmas break?" I was like, "No, we just really, really, really cracked down on the gluten, the glutathione, or the, not the glutathione, the glyphosate was in the gluten, and that was probably creating issues for her." So, what are the connections that you see between diet and attention in kids?
So I think it's funny because so many of the kids are colicky babies that sort of start out, and then I think a lot of them with what they're eating, they're almost refluxing into their mouth. And a lot of these kids will have fluid in their ears too. So I feel like sometimes it's affecting their ability to process and to hear because they're throwing up in their mouth and they have fluid in their ears. And then just the neurologic consequences. The reason we give ADHD meds is it increases your frontal lobe activity. So it increases dopamine and norepinephrine, but in a more kind of natural way to try to help you be able to focus and attend. And I think that these chemicals do the opposite. They just prevent your normal gut from being able to help you regulate, as well as your normal chemicals from releasing. So, it's very specific whether or not it's the dyes. Almost all of the kids that I treat that have ADHD have some food sensitivities. And it's interesting now that, I do offer to have people, some people will change their diets and some people won't. It's really hard. People love their food and people are very rooted in their food. So, and I'll see the kiddos that the families don't want to go down the dietary route. You kind of keep having to up and up and up the dose because they're just not responding as much because they have these other factors. And, no judgment. It's hard to navigate these things. It's hard to figure them out, but I definitely feel that it's multifactorial, and it's figuring out if your kid has food sensitivities, because if they have the food sensitivities, they have a leaky gut that you have to sort of seal. And then do they have yeast overgrowth? Do they have an excess of these chemicals and things that they're sensitive to that are causing neuroagitation? I mean, your kids are an example because they're both very different in terms
Yeah.
of what causes problems for them. But, when you manage it, everybody's better. So,
Right, right. It definitely manifested differently in both of them, and their food sensitivities are very different. Yeah. Is it possible for a parent to tell the difference between a behavioral issue and a food sensitivity without taking away the food and doing like a trial?
I mean, if you no, I think if you go get tested, if you have someone who will do, like I said, skin testing for not just allergies, but for sensitivities, then I feel like families feel more valid. And the other thing is, it's not a quick fix. Holistic medicine is a marathon, it's not a sprint. And we are a, quick reward, society. We want the quick answer, we want the magic pill. And this is the exact opposite of that. A lot of times with these kids, it takes sometimes 6 to 9 months for your gut to totally heal. And the families have associations with these foods themselves. I mean, sometimes it's cultural, sometimes it's their own, issues that this food makes them feel better, so they think that it's good. So it's difficult for families to navigate, and I totally understand because my family had to go through this as well. But it's a journey that's worthwhile, and it's something that, like I said, will in the long term, whether or not it's immediate behaviors or long-term inflammation in your body that can result in other issues.
Yeah.
It's worth it.
Yeah, I 100% agree. I've told people before, just do 30 days. Just
Yep.
tell the kid they can't have, or we're going to restrict this for 30 days and see what happens. Because the difference in those 30 days, if it's a sensitivity, is going to be profound. And you as a parent aren't going to be able to ignore it. Like it's going to be huge.
What's
Um,
amazing is the younger kids, they respond faster. So, like the babies, if I change things around in a week, they're better. And then as they get older, it takes longer. So, like the older the kid, the more you kind of have to hold the course and the harder it is to kind of establish a change. So, and I mean, that sort of makes sense. They have all that neuroplasticity and their brain is still growing and developing. So, but it's a testament to trying to initiate these changes as early as you can.
yeah.
And it has to be the whole family. That's what I tell everybody. You can't eat pizza in the corner and then give your kid kale. It's not going to work. You gotta eat together, do the same things, really try. And I think there's cute things like I love in the nutritional psychiatry, guidelines, they talk about eating the rainbow. So I always tell everybody, put a rainbow on the fridge and be like, every day we're going to eat a different color of the rainbow, just to try to get all those little micronutrients from all the different fruits and vegetables. And, so I think it's not just taking away the things that make them sick, it's making sure that you're also putting the things in that they're missing that since their gut has been sick, they weren't absorbing.
Yeah.
So
Yes. And there's a psychological or emotional connection to food that I think we experienced when trying to help Ella through everything, because she had to be restricted from nuts and other things. She was sensitive when we realized Jack couldn't have died, and of course I was taking everything out of the house. For her, it was just devastating, like devastating. And we still deal with like them both being emotional about food. It's very emotional for them. So there's a lot of support. Like it's something we talk about all the time, and we're always navigating. So it's not easy, like you said. And it's hard. It's hard because they get rewards at school for good behavior, or a good grade or whatever could be rewarded with a Jolly Rancher. I'm like, oh,
remember that all the time. Yeah.
I'm like, please don't give him a Jolly Rancher. Like you're not gonna like the kid after you give him the Jolly
So
Rancher.
you buy a giant bag of Yum Earth lollipops and
Yeah.
you gift them to the teacher and say, I love and appreciate you. Can we give these instead?
Yeah,
Yeah.
that's what we did all through lower
And
school.
married
I
to a
provide.
teacher, they're poor, they'll appreciate the gesture.
And in lower school, elementary school, that was really effective. In middle school, it gets a little different, but you figure it out.
It is hard, but but food is emotional. But I also think, the more kids are involved with food, the more they start making their own food. Me, I'm like a gardener. My office, it's the little bit of sunlight, it's every plant you can imagine. But I think growing some of your own food, having just an earth box where the first earth box we got like 7 months of kale out of it. But you can put dolomite in it, so it's really mineral complete and just helps fill all those gaps. But so we want our kids to feel emotional about food, but we want them to feel emotional about healthy foods. So if they start to be engaged in preparing some of their food and they start to be part of the decision making and choices, and just like you went and found, so Jack loves Takis, let's find a healthier version of Takis. So he gets that like salty, spicy thing that he wants, and he doesn't feel like he's being punished. But for Ella, it's hard. It's hard with a nut allergic and gluten because like so many of the breads that take the place of it are loaded with nuts because that's what they use.
Yep.
So it's a tricky, thing on top of it.
Yeah. So she kind of got some leniency, especially when Jack wasn't around with the dye, because she seemed less affected by it. So there's always kind of a juggling and balancing with them, which is tricky. Do you think the current talk of legislation eliminating chemical dyes is going to have an impact on our food?
I think if it actually happens, it would be magical. I don't think it's going to happen, but I would love for that to happen. But yeah, I mean, I am very upset about vaccine issues going on with the current administration. I'm a pediatrician to the core. I watched kids die from things that are vaccine preventable, and I do not appreciate what's going on in terms of those limitations. I was hoping RFK's fight and movement would be food. I really think that the agriculture industry is so powerful that he shifted because he realized it's going to be really hard to get this to go through. And it's super expensive. We know as consumers, it's costs a fortune to buy this stuff. But again, stop giving subsidies to people who make Doritos. Start subsidizing the organic farmers, start giving better options to our kids. Stop paying for our schools to have Kool-Aid and Pop-Tarts. They don't need that. So I would love, 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 love if that would change. I don't know if it's gonna, but
Yeah. The marketing, I always think about Fruit Loops. I'm like, if you eat Fruit Loops that don't have chemical dyes, they taste the same or better. I taste the chemical in the dye now that I don't usually have it. But over time, we would forget how that bright color, like it's not necessary. We don't need it. And when you go to Europe, it's not there and everything tastes amazing. And yeah, it's a whole different experience, but a better one. So we don't need the bright colors to attract people to buy. Like the marketing departments are pushing, right? We want the bright colors. We can't live without the bright colors. No, we can't. Um, so I did want to get to your thoughts on the vaccine and how you're approaching conversations with families now that there's kind of an attack on vaccines. And I'm sure some families or some parents feel uncertain because they're hearing one thing from the media. And so how are you approaching that with
I,
family?
I kind of always have the same sort of conversations. Like, I grew up, I think I was the last generation of kids that got that smallpox vaccine. And they lined us up in kindergarten. And the smallpox vaccine was 16 split needles, and you're contagious with smallpox for a month. So I think about if I had to give that shot, what my world would be like. But just line us all up. We all got our smallpox shot. I remember my mom's like, "What's that on your arm?" I'm like, "Oh, it really hurts." But smallpox went away. It eradicated disease. And so you don't have a smallpox shot and your kids don't have a smallpox shot. And when I was in med school, they said by 2010, polio would be gone. It'd be eradicated, and then no one would need that shot. And the same thing with measles. They really thought by that point these diseases would go away, which they never talk about that in the media. They never talk about disease eradication. Certain things we can't, the flu rapidly mutates, HIV rapidly mutates, those things we can find vaccines that might help if you get sick, but you can't clear it. Tetanus lives in the dirt. So certain things are never going to go away.
Right.
But if you eradicate diseases, then no one needs the shot. Big pharma doesn't make any, so that component makes me very upset that vaccines can cause eradication of disease isn't discussed, bothers me. So with the current issue, I mean, families are just scared. You love your kid, especially most of the people I meet with now are pregnant, and a lot of the younger people get most of their information from social media, from podcasts, from Instagram. So
Yeah.
so I worry that the information they're getting is misinformation, but thankfully with my practice, I have a lot of time to kind of talk to them. And I tell them when I was in medical school and residency, I saw kids die from epiglottitis, which is this horrible thing where their throat swells up and no one, even an anesthesiologist can't save them. And now that we do the hip vaccine, I never see it anymore. And that's just in the last 25 years. And the same thing with strep pneumo and the same thing with meningitis and pneumonia related to it. Like I've seen the diminishment of these horrible catastrophic illnesses from the vaccines. And my fear is if they do figure out how to take away vaccine mandates, we're just going to see those diseases come back and those shots have only been around for 20 years. So that means anyone over the age of 20 didn't have them. And it's colonized in your nose. So anytime you have a baby and you kiss the baby, can you give the baby hip? Absolutely. So it's scary. And I think part of it too that makes me most sad is that people don't trust their doctors. And I am super spoiled that I have time to talk to people and I can develop different relationships. Like when you said how you love Jack, I love Jack. I love your kids and the kids that I take care of, it's a very different sort of dynamic and relationship kind of thing. And I feel bad for fee for service docs that don't have the time to develop that relationship or to talk to people. But I think it's important to realize that there are clean options, single dose vials that are preservative free of these vaccines, and that really we only vaccinate against things that morbidity, mortality, which means significantly injure or kill your kid. No one's doing a vaccine for roseola and nobody's doing a vaccine for Fifth's disease. They're just kid stuff that they're going to get. And there's thousands of things they're going to get that nobody needs to vaccinate. So I get sad that there's an attack on traditional medicine, that these are poisoning people and making kids sick. I can say that I take care of a lot of kids on the spectrum, and I have had parents talk about like when they got a vaccine, they felt they saw a regression or they saw behaviors come out. But most of those kids were super neuroagitated. They were eating foods, they were eating dyes that they shouldn't. They were already in such a neuroinflamed state that if you give them a shot that's going to give them inflammation, you're going to see worsening. Now, do I think it caused regression or caused disease? Absolutely not. But most of those families that came to me, I was like, look let's figure out how we can change their diet. Let's try to help them. But then you have to let me vaccinate them. And they have. So I'm really proud of the fact that I have lots of neuroatypical kids that came in partially vaccinated and are now fully vaccinated because they trusted me and the process, and their kids got better. So
Yeah, I think people don't understand that they can even alternate or alter the shot schedule when they're little, which we had to do with Jack because he did have a reaction when he got multiple. So after that, we just spread them out.
yep. And a lot of my families opt in, and we give that option too, where they come in every month and just get like one shot as opposed to like two at the same time. When he was little, it was like four at the same time. But now they've combined and made a sort of cleaner version. But yeah, I mean, for us and for me and for Dr. Logue, we're fine spacing them out as long as you're going to do them. Like the families that are like, that's poison, we're never going to do it. Bring unvaccinated kids into my world, especially with the medically complex kiddos I have. I promised those families that the kids were immune suppressed, that I'm not going to bring that in. Apparently, there may be legislation saying that pediatricians can't turn away people who are refusing to vaccinate. So that's a whole nother discussion, but we'll see.
Wow. Wow. Yeah, here in Florida, I think, they're saying they're not going to mandate it in the schools. We're fortunate because we're at a private school, so private schools don't have to follow that if it happens, but it's very scary, especially for young families, I think.
Well, I think that there's a movement as well to defund the Vaccine for Children program, which what the Vaccine for Children program is, it fills the gap. So people who are under or or uninsured or who have Medicaid, VFC pays for it, and that's paid through the CDC, and it's super expensive for the government. So if they take away the mandates, then the government doesn't have to pay for all this. But then you have our most vulnerable, poorest kids that won't have access. 2-month vaccines, if you pay out of pocket, are $440 right now. There is no way a family on Medicaid can afford that. So you're just going to have these little kids that are really high risk that now they can't be protected against things, even if the families want the vaccines, if they take away VFC. So it's very scary.
It's very scary. Hopefully something will change and we won't have those.
Well, we all have to use our voices and our votes.
Yep, absolutely. Well, I appreciate this conversation so much. I want to ask you one more question. What are three simple, realistic steps that parents could take today to improve their child's health with food or through food?
So I think first and foremost, to try to embrace 80/20, to try to have like 80% of what you eat is real food and 20% is processed. So I think that's like I said, the nutritional psychiatry Bible, like the first thing is 80/20. I think, again, trying to eat the rainbow, trying to talk to kids about multicolored and having more healthy foods. It's clearly not dye enriched foods, but natural foods that have like multiple colors. And then I think trying to be dye free and organic as much as you possibly can. It takes time. It's hard as a parent to sort of figure out the cheaper ways to do this, but it's so worth it.
Yep, great. Thank you so much.
This is fun.
This was fun. It was fun to get to talk with you a little bit without the kids here. So I get to talk. There was like, Mom, you talked to Dr. Cross so long.
We get
So
to get
this
out
was
of
great.
the way.
This was great. Thank you so, so much.
Welcome. Thank you for having me.